I'm Talia Byers, and I'm going to share a quick clip with you.
Stop licking. Stop scratching. Stop licking your feet. I'm going to get the cone. Stop. Stop scratching. I'm going to get the cone. That's it. I'm getting the cone.
So if this sounds like you, if this sounds familiar, especially at night, dogs and cats like to scratch and lick at night. If this sounds like you, if this sounds familiar, your pet may have skin allergies. There are different kind of allergies that our pets can be allergic to. Those include environmental seasonal allergies, flea bite reactions, and food sensitivity food reactions. Today, we're going to talk about the environmental seasonal allergies. We are not going to talk about flea bite reactions or the food sensitivity. These two are a little different and require a little different treatment. Flea bite reactions, if your pet is allergic to flea bites, a good flea and tick prevention is key here. Something like a Seresto collar will help with that. And a food sensitivity food allergy is they are actually allergic to something in the food, and this requires a 12-week food trial. So with any three of these, you're going to talk to your vet about treatment, but these two are a little different and their treatment's a little different. So environmental seasonal allergies, seasonal is a loose term because they can actually have allergies year round. Weather definitely plays a factor into it. If it is a mild winter, a wet winter, and not really snowy or cold, or if it's a really wet spring, they definitely can have allergies year round and can definitely affect the pet's allergies. So what is an allergy? It is the hypersensitivity of the immune system. The immune system goes into an overdrive, overproduction, and it's the body's natural defense. According to VCA, it's the body reacting to the allergen, and the pet is actually diagnosed with skin dermatitis, and that means it is a skin irritant. The skin is red, puffy, scratchy, itchy, just kind of miserable skin. The allergens, just like people can have like a hay fever, that is how our pets' bodies react also. Your plant-based are your grass, weeds, and pollen. Microscopic are your mold and your dust. So how it works is the allergen comes in, it comes into the skin, it can come in through a crack, a pore, an open sore, and the immune system goes into overdrive, overproduction of those antibodies, of those antihistamines. You can see that the skin is red and puffy, itchy. Up here it's kind of flaky, so just not very good, healthy skin. Here on the right side is healthy, normal skin. There are some allergens that still do come in through the skin, but the immune system does not go into an overdrive. It doesn't go into that overproduction. So symptoms and treatments. That depends on where your pet is in their allergic reaction. Some of the mild symptoms can include red, puffy, itchy skin, swollen skin or eyes, licking feet, or ear infections. Any one of these symptoms can mean allergies or a combination of them. So treatment for these symptoms, talk to your regular vet. There is allergy medicine available. There is a once a day pill like Apoquil that is for both cats and dogs. And there is also a once a month injection, Cytopoint, that dogs can take. That's a 30-day allergy medicine. There's allergy food on the market. This can help with that skin dermatitis, keep the skin calm, not puffy, not red. These are maintenance doses. They can be worked in combination to help keep that skin not so red, not so puffy. Your more severe symptoms, they require more immediate attention by your regular vet or an ER clinic. They can include a swollen face that can lead to trouble breathing. Itching themselves raw, red, and open can lead to infection. Vomiting and diarrhea can lead to GI upset and chronic ear infections. These are the ear infections, either single or double ear infections, that you just can't clear up, are reoccurring, are chronic, and they can't clear up with regular antibiotics. Your regular vet May say anti-vomiting medicine, anti-diarrhea medicine for your chronic ear infections. They can do antibiotics or steroids. Itching to themselves raw if they have an infection, that can be antibiotics. If the pet has trouble breathing or a swollen face, these two do require an ER visit, a 24-hour ER visit. That can't wait till the morning to call your regular vet. Get them to the ER visit. So this is Yana. She's a 4-year-old domestic short hair female spayed kitty. She's actually my mama's kitty. She has had a history of allergies since she's been a baby. Red, puffy, itchy skin, just not very healthy skin all over. And so this is a bad flare-up she had. The R means the right side of her body. You can see she's missing hair. She's red. She's puffy. She can get those little back legs up and just dig and scratch her side. Here on the right, this is a pretty big wound, and it's pretty red, open scab that it's not open, it's red scabbed over, but it's pretty fresh and it's pretty deep. Here you can see a close-up of that wound. She's red, puffy, but it's pretty deep, pretty fresh, pretty open. Here is her left side. This wound is completely open, not scabbed over. Again, she can get those little back legs up and just dig and itch and rub herself raw. She's puffy underneath her eyes, and she has a scab here that she's itching at her face. Underneath her belly, she's pretty pink red. This U, she's pretty puffy and swollen. She can't scratch herself, so these are actually bite marks that she's bending over and biting her belly, just itchy, scratchy, puffy. We took her to her regular vet. The regular vet did a long-lasting 14-day antibiotic, which is Serenia, and a long-lasting 3-week steroid dexamethasone. So hopefully the combination of those two injections, the long-lasting antibiotic and the long-lasting steroid, would help keep her skin calm down and get this flare-up under control. So this is the left side. That wound is not open and it's starting to scab over. Still kind of puffy under her eyes. Her belly, still puffy, pink, red, still scratchy. This is day 2, so 48 hours after treatment. There on the right side, her skin is starting to turn white, not so red and puffy. There's that wound. That deep wound there on the right is not a red scab. It's that brown healing scab starting to heal up. Eyes, puffiness has gone down. And then under her belly, she's still a little pink, not as red, but that U there is significantly gone down. That swelling of U has significantly gone down. She's still a little puffy up and through here, but that big U swelling has significantly gone down 48 hours after treatment. This is 2 weeks after treatment. There on the right side, she's nice white skin, not red, not puffy. That wound, deep wound, is not healed, but it's that nice brown scab, healing scab. And you can actually see around the edge that she's starting to grow some hair back. Her belly is nice white, not puffy, not pink, no bite marks. She looks really good that her skin is calmed down again there underneath her belly. There's her little face. You can see no swelling under the eyes. This scab has completely healed up. She looks better there, and she's a happy kitty again. So the treatment definitely did work for her. The combination of the steroid, long-lasting steroid, and the long-lasting antibiotic did really work for her to get this flare-up under control. And her owner will talk to the vet about getting on those maintenance doses, either the food or the allergy medicine. So this is my dog. This is Ladybird, and she's my little allergy dog. She does get the Cytopoint, the once a month 30-day allergy injection, and it helps to keep her skin calm and under control. She's here in her cone looking miserable. So 10 out of 10 dogs agree, just say no to the cone. Get those pets to your vet. Get those allergies under control as a maintenance dose. We don't want those flare-ups and infection. and just they're miserable, rubbing themselves raw, itching themselves raw. So get them to the vet, get on a maintenance dose of allergy medicine. Thank you, and let me know if you have any questions.